March is Multiple Sclerosis Awareness Month, a time to shine a light on MS, a disease that affects an estimated 900,000 people in the United States. Today, we explore a less talked about and often misdiagnosed related condition of MS called pseudobulbar effect, or PBA, which may cause sudden, frequent, uncontrollable episodes of crying or laughing in patients with MS. Joining us today is Dr. Mayor Joshua Hasbani, a renowned neurologist, to share some insights from his own clinical experience with patients who experience PBA. Dr. Hasbani, thank you so much for joining us here on YC. We're going to start with, can you explain how PBA is connected to multiple sclerosis and why it's important for patients to be aware of this condition during MS Awareness Month?
Thank you so much for having me on the show today. So multiple sclerosis, as you said, is a disease of the central nervous system that causes weakness or numbness or other kinds of symptoms in patients who have MS. And it's the result of the immune system, which normally protects the body. It mistakenly attacks the nervous system and interferes with transmission of nerve signals from the brain and other parts of the body. As a result of this damage, these patients may experience a less commonly discussed but very important condition called PBA, or pseudobulbar affect. This condition, which occurs in about 10 to 46% of patients who have multiple sclerosis, leads to uncontrollable laughing or crying spells that are involuntary, sudden, frequent, and they're disruptive, and they're either exaggerated or don't actually match how the patient feels or the person feels inside.
And how does PBA differ from other emotional disorders like depression?
So you're correct. PBA and depression can have overlapping symptoms, in particular crying. The distinction has to do with whether the symptoms are how the patient actually feels on the inside or not. In depression, patients are sad on the inside, and the expression of crying occurs at the same time that they are sad, and they can usually control the crying. However, in PBA, the patient may not feel sad inside. In fact, they could feel the opposite, and the crying spells come out inappropriately, and they can be exaggerated, and they're frequent, and they're disruptive, and they can occur in social situations or while the patient is at work, and as a result, identifying it and treating it can be very helpful for them.
And what challenges do patients with MS with PBA face, and how can those be addressed?
So the main challenge they face is that these episodes can occur socially or they can occur at work, and as a result, addressing it with medication can be very helpful. There is an FDA-approved option called Nuedexta, which is a combination of dextromethorphan and quinidine sulfate, and it's clinically proven to reduce episodes of PBA. While the most common side effects were diarrhea and dizziness, these are not all the risks with Nuedexta. For example, if you're taking any medications that contain quinidine, quinine, or mefloquine, or monoamine oxidase inhibitors, or if you've ever had an allergic reaction to these medications, it's suggested that you not take Nuedexta. Also, if you have a personal or family history of myasthenia gravis, or you take other medications and supplements, it's important that you speak to your doctor to determine if Nuedexta is right for you.
Those are specific treatments available for PBA, correct?
That's correct. It's been clinically proven to reduce episodes of PBA in patients who have PBA in the setting of multiple sclerosis. Yeah, for more information about PBA and Nuedexta, including full prescribing information, patients can visit treatingpba.com.
Dr. Hasbani, thank you so much for spreading awareness about this. I had never heard of it, so hopefully a lot of folks can learn some information and learn more about the treatment opportunities available with Nuedexta. Thank you so much.
Thank you for the opportunity.